Welcome to Ask the Doctor series hosted by Emanate Health. I'm Dr. Gurjeet Kalkat. I'm the Chief Medical Officer, and I'm joined by
Dr. Fu-Cheng Chuang.
And Dr. Chuang is an internist practicing in West Covina. Today's topic is diabetes, and we're going to focus on adult diabetes. A little bit about diabetes. The prevalence varies from 5 to 30% depending on the community one serves. As you may know, the prevalence is much higher among Hispanics, South Asians, and African Americans. So, Dr. Chuang, let's start with what is diabetes?
So, broadly speaking, I'm sure people have heard about type 1 and type 2 diabetes. Type 1 diabetes is when your body lacks the ability to secrete enough insulin to process the dietary carbohydrates. Whereas type 2 diabetes is more of an issue with insulin resistance. Your body produces sufficient amount of insulin, but your cells are not responding to that insulin.
And correct me if I'm wrong, but in adults, about 90% of the diabetes is
type 2 diabetes.
Type 2 diabetes,
yes.
As we call it. There's type 1 and there's type 2. Type 1 is among children, but most of the adults majority actually have type 2 diabetes. All right. So how does one diagnose diabetes?
So diabetes can be diagnosed by a simple blood test. The most straightforward way is to do what we call an A1C test. A1C test is the most straightforward way of diagnosing diabetes. A1C measures the average glucose in your bloodstream for the past 2 to 3 months. And a normal A1C would be 5.6 or below. Anything above a 6.4 is when we say someone has diabetes. Now, between 5.7 and 6.4 is where we call someone who has prediabetes.
And what's the implication or the importance of prediabetes?
So prediabetes signifies that you are at increased risk for developing diabetes in the future. And more recent studies have shown that even though you're in the prediabetes, not necessarily the diabetes range, you are still accumulating damage in your target organs, namely your brain, your eyes, your kidneys, and your vascular system.
Right. And how do you monitor a pre-diabetic? How often do you see them? What are the recommendations?
So for people with prediabetes, I like to see them every 3 to 6 months just to make sure that their A1C level stays good or improves. And I also want to make sure that they are doing lifestyle modifications to change, the course of the disease.
Yeah, as you brought up lifestyle changes, what are the most 2 or 3 important things one can do in their life to prevent progression of diabetes or even to develop diabetes?
So I would say the most important thing is to make sure that you live an active lifestyle, make sure that you exercise on a regular basis at least 3 times a week. And also on top of that, if you can look at your diet and reduce the amount of carbohydrates you consume in your diet. I think those are the 2 main important things.
And losing weight if
if one has obesity.
All right. And then you mentioned, a blood test to diagnose and to manage diabetes. Can you comment on various blood glucose monitors available for the average population?
The original way of checking blood sugar involves the straightforward finger stick blood test. And those are done 1 to 3, 4 times a day, depending on how severe your disease is. But more recently, there's these continuous glucose monitors where a simple disc is being placed in your arm, and that monitors your sugar on a continuous level. And usually that's linked to your phone so that you could track how your sugar is doing.
Yeah. And if I'm correct, that majority of the time, maybe 90% of the time, you just need the finger stick test. The continuous glucose monitoring is reserved for the ones who are very severe or very brittle?
Yes. So the continuous glucose monitoring is usually reserved for people who are on insulin and who need to make several insulin adjustments on a daily basis.
Okay, good. All right. And then we're talking about diabetes. So why is the control of blood sugars so important to keep somebody healthy? What does high blood sugar do to the body? What damage?
So the most severe consequences of high blood sugar is that it starts to damage your vasculature, making you at higher risk for developing strokes and heart attacks, as well as kidney failure. And that's why we want to make sure that your blood sugar stays low so that we can prevent these diseases from happening.
Okay. All right. So let's learn about diabetes management. Now, first we talked about a blood test, then some lifestyle changes. So what are the next steps in managing a diabetic?
So the steps in managing diabetes, besides lifestyle changes, which is the most important aspect, would be medications. There are oral medications. There are several classes of oral medications that we could prescribe to control someone's blood sugar. There are also injections that we could use. Things like insulin, people often think about when we talk about diabetes. But there are these newer classes of medications called GLP-1 agonists that often also come in an injection form. And these are not insulin per se, but they do help with glucose control.
Yeah, the GLP-1, have become very popular for many other reasons, also for weight loss. But would you comment about what are the indications for GLP-1 medications?
So what we know about GLP-1 agonists is that these medications, they tend to have a protective effect on the kidneys and on the heart. So if you're someone with risk factors for kidney disease or heart disease, then these GLP-1 agonists would be a better choice compared to other classes of medications.
And probably help in preventing strokes too, because
Yes.
you keep the blood vessels open.
Definitely.
And I'm hearing more and more that if you use them, you lose weight. One loses weight, and things associated with weight loss, like sleep apnea, is helped. Issues with heart arthritis can be helped. So a lot of things down the road, GLP-1s are going to help with. But so it's an evolving issue right now.
Yes.
And so let's go on next to one has to learn about diabetes. Education.
Mm-hmm.
So we do have at Emanate a diabetes education department, and we have diabetic registered dietitians who are counselors, and the patients can make use of them. They can have a consult with them. They can follow up in their clinic and learn about diabetes. Because I think the most important, you'd agree, that is to manage your disease well, you have to know what it is and what to do, what to follow, and be an educated patient.
Mm-hmm.
So let's talk about diet. That's, I think, the most important thing in managing diabetes. So there's a lot of confusion about diet. How many calories can I have, whether I can have fruits or not, whether any sugar drinks are totally prohibited, am I not allowed to have any desserts? Let's have your comments on those.
So what I usually tell my patients is that diets are hard, all right? And for me, I would prefer that my patients make small changes very slowly that they could sustain over a long period of time, rather than go on a very drastic change in their diet and they end up quitting a month or two later. Mm-hmm. We do have nutrition programs at our clinic that will help facilitate these type of discussions, and we have dietitians that could help patients find the right diets for them.
Okay, and so fruits are not prohibited, it's just depends on how much you have and how you have them?
Right. I would say that things that contain high sugars, you can still have them. You just want to make sure that you're not eating the same amount as you were before.
Limit them.
Yes, because maybe that was what's contributing to the diabetes in the first place.
And fruit itself is better than a fruit juice. Would you agree?
Definitely fruit juice. I would never recommend fruit juice to a patient. Just think about how much fruit you need to put in the blender in order to get that amount of juice out.
And basically what happens is that when somebody drinks juice, the blood sugars shoot up, and then the insulin is secreted, and the body just goes into a frenzy. And then you want to comment about what happens with high blood sugars, the spike?
So when you have a spike, your body produces a lot of insulin, and that will produce a lot of physiologic changes, including making people feel tired, decrease their concentration, and also with that insulin load, it also tends to make people gain more weight.
And you get hungry quicker too.
You get hungry quicker.
So you end up eating more.
Yes.
Okay. All right. Any other recommendations on the diet?
One other recommendation I always tell my patients is to increase the fiber content in their diet.
And the reason for that is to slow the absorption of sugars?
Yes. The more fiber you take, the slower the absorption of sugar in your system, and overall better control on your blood sugar levels.
And for the same reason, some people would say that have the proteins first and the carbs later if you're going to have them.
Yes, that would be the same reason.
That trick works for a lot of people. So, Dr. Chuang, we've learned a lot about diabetes. Let's have you summarize about that, basically about adult onset diabetes.
Okay. So I guess the main takeaway is that diabetes is very common, and especially if you have a family history of diabetes, I would encourage you to visit a primary care provider and get tested, get screened for diabetes. The earlier we can detect these things, the better we can control it. And also make sure that you live a active and healthy lifestyle. If you're overweight, put in the effort to lose the extra pounds. And if you know that you're consuming a lot of high sugary foods, then make sure that you cut back on that and maintain an active lifestyle is probably what I recommend.
And then if you have been diagnosed with diabetes, adhere to the medicines. It's very, very important that you control your sugars well, because it's a silent killer. Blood sugar, even mildly elevated, is damaging the blood vessels in your body for continuously, rather. And unfortunately, there are many undiagnosed diabetics who develop kidney disease, and they didn't even realize that they had diabetes. All right. Okay. So we have some questions. Okay. The first one I see is, I've been told that I have metabolic syndrome. Dr. Chuang, can you comment on metabolic syndrome?
Yeah. So metabolic syndrome is a group of risk factors for cardiovascular disease, and these include high blood pressure. If your blood pressure is above 130/80, that would be one of the risk factors. Second one would be impaired fasting glucose. As we mentioned, when you have diabetes, your glucose metabolism has been impaired. So that would be another risk factor. Then there's increased triglyceride levels. So triglyceride levels over 150 would be another risk factor. A decreased HDL particle. HDL is what people commonly known as good cholesterol. When your HDL particle level is less than 40, that would be another risk factor for metabolic syndrome.
Yeah, so sadly it complicates the issues even more.
And abdominal obesity.
Absolutely,
Yes.
Yeah, absolutely. So I think clearly those folks who have metabolic syndrome really need to see their doctors very often and take care of all the issues Dr. Chuang mentioned. Next question I have is, what are the roles of herbs in managing or preventing diabetes or controlling blood sugars?
So a lot of people take these herbal supplements that their friends tell them that, oh, this thing helps with diabetes control. What we know so far is that there's very limited data on the effectiveness of these herbal supplements. There's also an issue with lack of regulation with these supplements. So my recommendation is, if you're prescribed a medication, definitely adhere to the prescriptions. And if you do want to start taking an herbal supplement, first consult with your physician first.
Very good, yeah. And it's our understanding that they help only with very mild cases of diabetes. And as you said, the products are not standardized, so one doesn't know what's happening with the sugars. So at the most, you can see maybe a 5 or 10% drop in blood sugars with these herbs like cinnamon, milk thistle,
bitter melon extract.
Bitter melon extract, yeah, good one. Yeah. So we don't recommend managing your diabetes with herbal medicines. You agree with that?
Yes.
Okay. The next question is, I am overweight and my doctor was suggesting that I take an Ozempic-like drug, but I'm hearing that it's not covered by my insurance and it's very expensive. Dr. Chuang, any comment on that?
Yes, so sometimes getting these newer GLP-1 agonists can be a bit difficult, but I would say that if the patient has risk factors for things like obesity, for heart disease, for kidney disease, the physicians will work with the patients and also work with their insurance plans to try to get these medications covered.
Very good, yeah. More and more coverage is happening. There is a shortage of these drugs because there's a huge demand. And if one qualifies, you can also get them free directly from the manufacturer. But it is a task. But doctors like Dr. Chuang will do their best to get you the right drug so that you can drop your sugars, lose weight with these medicines, and also help you with any kidney disease one may have with diabetes. Next question I have is, I have diabetes, but I also have asthma for which I take oral steroids. And whenever I take them, my blood sugar goes up. How does one manage diabetes along with oral steroids?
So oral steroids, they do tend to increase your blood sugar. The best way is to make sure that you work closely with your physician to maybe temporarily increase the dose of your diabetes medications if you know that you're going to be on oral steroids.
Very good. And basically, hopefully, your asthma gets better and you don't need them, and that will really, really help manage your diabetes. And actually, related to that, Dr. Chuang, there are some interactions of some drugs, diabetic drugs, and some other drugs. I think the question is, how do I determine if there's any potential interactions of my existing drugs with my diabetic drugs? Would you comment on that?
Yeah, so the most important thing I would say is to make sure that your physician knows all the medications that you're taking, including any supplements that weren't prescribed. That way the physician can help you determine if there may be any possible side interactions with these medications and supplements.
Good. Next question is, I have pretty severe diabetes and I'm not on insulin. How do I keep it that way that I would not need insulin?
So the way to prevent you from needing insulin would be to reduce the risk factors by any means you can. And those risk factors include obesity and all the metabolic syndrome risk factors that we talked about earlier. Living an active, healthy lifestyle would be the most important thing. So if you stay active and control what you're eating, there's a great chance that you won't progress to severe disease that requires insulin usage.
So we've learned a lot about diabetes today. I'm hoping that what all we've discussed, you will be an educated customer to take care of your diabetes better. Any closing thoughts, Dr. Chuang?
So diabetes is very prevalent, so I would encourage everyone to get screened for diabetes. And if you unfortunately do have diabetes, I would urge you to take the disease seriously, but there's no need to panic. Your PCP will work closely with you to treat the disease.
Or you can look up Dr. Chuang and see him for diabetes issues.
Yes.
So that's all on diabetes today. Until next time, thank you for joining us.
Thank you.
Thank you.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate Health videos.